Hello everyone. Today we will discuss some of the important and the high yielding topics in microbiology. I will also discuss with you on the basis of pictures and the clinical scenarios. So we'll go to them one by one. Okay. So the first picture for you is, okay, what are you seeing here? This is a bacteria which is growing on a nutrient agar that is showing. What is the color of this? This is bluish green, right? So that is showing a bluish green color growth. So this is nothing but, what do you think it is? This is nothing but a pigment, okay? So this is the pigment production. Okay, so this is the pigment production. So basically this bluish green pigment is produced by which organism? Can you tell me the name of the organism? So this is the bluish green pigment is produced by Pseudomonas aeruginosa and the pigment named as pyocyanin. Yes. So what are the other pigments produced by Pseudomonas? One is pyocyanin, pyoverdin, pyorubin and pyomelanin. Okay. Verdin is the yellow pigment, rubin is the red pigment and melanin is the brown pigment. Okay. So this is about the Pseudomonas aeruginosa pigment production. Okay, so you have another picture here. What is this? Again, there is a nutrient agar. On the nutrient agar, you can see the red colored colonies. Again, this is the red pigment produced by some organism. What is it? Can you guess it? What is this organism? This pigment is called as prodigiosin. So this organism is none other than Serratia marcescens. Okay, so this organism is Serratia marcescens, which produces a red pigment, and the name of the red pigment is called as prodigiosin. Okay, so these two are the prominent organisms which produces the pigment. So I would also like to list down you the other organisms in microbiology which can produce pigment. So I would list down the pigment producing organism. Okay. So one what we have seen is already Pseudomonas aeruginosa. The other what we have seen is Serratia marcescens. Other than this, there are few bacterium which also produces the pigment. One is Chromobacterium violaceum, produces a violet pigment. The next is a Flavobacterium, produces yellow pigment. And our own Staphylococcus aureus produces golden yellow pigment. Okay, so these are some of the bacterial examples of producing pigment. Like some of the fungus producing pigment. One is Rhodotorula, okay, which also produces pink to red color pigment. Then we have Trichophyton, rubrum, producing a red pigment. Okay, and then we have Penicillium marnefi, also produces a red pigment. So these are some of the important microorganisms that can produce the pigment. Okay, so now we'll move on to the next picture. Okay, what is this you are seeing here? This thing which you are seeing here is a vector. What is the name of the vector? Any idea? It is the Cyclops. Okay, this vector is Cyclops. So do you remember what are all the disease where the Cyclops is an intermediate host? Yeah. So there are two parasitic infections where Cyclops are the intermediate host. The first disease I would remember is Diphyllobothrium latum. Diphyllobothrium latum, okay? And the second disease is Dracunculus medinensis, is also called as the guinea worm disease, okay? The number one is Diphyllobothrium latum, and the second one is for Dracunculus medinensis, is also called as guinea worm disease, right? For Diphyllobothrium latum, Cyclops is man is the definitive host, Cyclops is the first intermediate host, and fish is the second intermediate host. Whereas for Dracunculus medinensis, man is the definitive host and Cyclops is the only intermediate host, okay? So please remember this, and now I'll show you the next picture. What is this? So here you can actually see there is an adult worm that is being removed from a blister of a person from the lower limb. So this is nothing but Dracunculus medinensis or the guinea worm disease. So see, it is very fascinating to see that an adult worm is being removed from the leg of the person. Okay, so here if I have to tell you the important points about Dracunculus is an disease which is eliminated from India in the year 2001. So how is this disease spread? Is man drinking the water which contain the Cyclops, right? The Cyclops will have what? The Cyclops will have the larva of Dracunculus. When the Cyclops is taken by man, this will go to the different tissue and this larval form will reach the subcutaneous tissue and then it develops into adult. And when man comes in contact with water, the adult worm comes out to lay the larva in water. Okay, so interesting, no? The life cycle is, so it comes out to lay the eggs in the water. So how is it able to penetrate the skin and come out? The adult worm used to secrete some digestive enzymes and that is able to make a blister on the skin, and when this person puts the leg in the water, so the adult female will know that this is the time where she has to lay the larvas. So when this person comes in contact with the water, the adult female Dracunculus, she comes out and then lays the larva in the water, right? So then again in the water, the larva is eaten by the Cyclops, and when somebody drinks the water which has the Cyclops, then the cycle keeps continuing. Okay, so this is a very interesting factor about the Dracunculus medinensis. Okay, we'll go to the next picture. So this is the picture. What are you seeing here? So this is a dark ground microscopy. What are you seeing here? You are seeing here is thin coiled spirochetes, right? So the spirochetes, whenever you want to visualize any thin microorganism, then the preferred method of microscopy is the dark field microscopy. So since that I have shown you one of the spirochetes, so it could be one of the spirochetes, right? It is either Treponema, either Borrelia, or it can be Leptospira. Treponema causes, like Treponema pallidum, causes syphilis. Then there are other non-venereal Treponema which causes the skin disease and sometimes also causes disfiguring bone loss, right? So this is about Treponema. What does Borrelia causes? Borrelia causes the recurrent fever, as well as Borrelia burgdorferi causes something called as a Lyme's disease. And Borrelia vincenti is associated with Vincent's angina. And when we talk about the other spirochete, which is Leptospira, it is associated with a condition that is called as the hepatorenal syndrome, Weil's disease. or leptospirosis, which is the disease which involves the liver and the renal system, right? So now here, so we know it is a spirochete. So I'm going to show you the next picture which will lead you to the diagnosis. What is this? This is an very typical annular lesion. Okay, this is the annular lesion. It is caused by the bite of a tick. Okay, this is also called as erythema migrans. This is a very typical of something called as Lyme's disease. Okay, Lyme's disease. So this picture, what you are seeing here is Lyme's disease, and the agent causing Lyme's disease is Borrelia burgdorferi, and the vector here is tick. Okay, the vector here is tick. So this you should know. So this is nothing but the Lyme's disease, and the picture shown here is nothing but erythema migrans, right? Okay, we'll go to the next picture of discussion. What is this? Okay, this is a vector definitely, right? So this vector is nothing but a rat flea. Okay, this is a rat flea. So when I say rat flea, the disease immediately comes to my mind is the plague, right? So what I'm seeing here, so I could see there is a staining of a bacteria which is showing a bipolar staining. So this is nothing but the safety pin appearance in the Vasen stain, right? So safety pin appearance shown in the Vasen stain. So this is basically a rat flea, and when you see a bipolar staining bacteria, then it is definitely Yersinia pestis. So this is nothing but plague. Okay, so the plague can be either a bubonic plague. Okay, it can be a bubonic plague, it can be a pneumonic plague, or it can be a septicemic plague. Okay, so when you get this picture, and you have to be very careful when you read the question, you should know whether it is a bubonic, whether it is an septicemic, or whether it is a pneumonic plague. Okay, so you should be able to answer this question only when you know that what is the vector and how does the vector looks, and what is the laboratory finding in the case of Yersinia pestis. Okay, fine. We'll move to the next figure. What is this? So this one, when I could see there is a blue background with pink color structures, right? When I see anything in the blue background, with the blue background and pink colored structures, there's nothing but an acid-fast staining. Okay, so here what I'm saying is a modified acid-fast stain. Why? Because I could see this oval oocyst. Okay, this oval oocyst is nothing but it is the oocyst of Isospora belli. What I'm seeing here is the oocyst of Cryptosporidium. What I'm seeing here is the oocyst of Cyclospora. What is very important is you have to remember the shape and the size. So here for Isospora, it is oval in shape. Cryptosporidium is spherical, and Cyclospora is also spherical. Right? So the oocyst of Isospora is big. It is around 25 to 30 micron, and the Cryptosporidium is the smallest. It is around 2 to 5 micrometer, and Cyclospora is just double the size of Cryptosporidium. It is around, I would say, 5 to 10 micrometer. Okay, so when you see this kind of acid-fast structures, and this is a stool sample because basically these three parasites are known to cause persistent diarrhea in HIV patients. Okay, so it will cause what? Persistent diarrhea in HIV patients. So it is very important MCQ. So it can be asked in any exams. So here comes the next question is, which one of them has an property of autofluorescence? When you talk about autofluorescence, then it is cyclospora. Autofluorescence is cyclospora, and the other question will be, which one of them has a property of autoinfection? Autoinfection is cryptosporidium. Very important MCQs. Autoinfection is cryptosporidium and autofluorescence is cyclospora. Okay, we will meet in the next discussion. Thank you so much.